Welcome, and thank you for joining our webinar, Cenegenics Carolinas Live, the Antidepressant. On the line, we have Dr. Mickey Barber, Age Management Specialist and CEO, CMO of Cenegenics Carolinas, as well as Tiffany Jackson, Cenegenics Carolinas Nutrition Specialist. Please stay tuned to ask your questions of Dr. Mickey Barber and Tiffany Jackson after their presentation. Well, good evening, everyone. Welcome to our March webinar, the Antidepressant. Depression and anxiety are common mood disorders affecting many Americans and common symptoms that we see here at Cenegenics with new patients. The exciting part is many of our patients' symptoms dramatically improve once they start on our program by balancing their hormones, replenishing nutrients, and exercising. So whether it's a serotonin imbalance in the brain, hormone deficiencies, inflammation in the body, the key is to first understand and address your own unique medical predispositions that are contributing to stress, depression, and anxiety. So tonight we have Dr. Barber on to discuss these topics and the way our Cenegenics programs can help reduce your symptoms. So welcome, Dr. Barber.
Thank you, Tiffany. I'm really excited to be talking about this today. Most of us are comfortable talking about stress and anxiety, but depression can be a kind of a sensitive topic, although most of us probably know someone who's been sad or down or depressed at one time or another. For many people, however, being depressed can really last for weeks, months, and sometimes years. And like diabetes or heart disease, depression is a very serious medical condition that can grow progressively worse if left untreated. It can interfere with how we succeed in the world and how we relate to our colleagues and loved ones and how we move through life. Depression darkens our thoughts. It can drain our energy and drags at our work life and our special relationships. So I do want to say right now that if you're listening or participating in this webinar and if you are on antidepressants, we are not recommending that you stop your medication. Some types of depression and mood disorders only respond to medication. The purpose of this webinar is really to share how you and your Cenegenics program can help patients deal with chronic stress and depression.
Yeah, that's a really important that we want to make. We're not recommending anybody to stop their meds. We just really want to give all of our listeners out there an overview of the mood elevating benefits our patients have experienced. We hear it over and over. Patients come into the office and, you know, they think that we're just here to help balance their hormones and help them with energy and losing weight. But a big side effect to all of the things that we do here is mood balance. And a lot of people that do have some cognitive depression, anxiety, things like that, we're able to make a really big difference in how they feel. So Dr. Barber, why don't you just take a minute to go ahead and review the signs and symptoms of depression?
Sure. Well, this slide really lists the signs and symptoms of depression, and really they come from two different aspects. One is the emotional symptoms, and those are feelings of sadness, anxiety, and emptiness, feeling restless or even irritable, feeling hopeless, worthless, or guilty for no good reason, and loss of interest or motivation in activities or hobbies that you may once enjoyed, like a loss of interest in sex, or maybe you used to enjoy playing golf and now you don't, or just things like that. And then there's the physical symptoms. Disturbed sleep pattern, very common. You either sleep too little or too much, or wake up in the middle of the night, or wake up very early in the morning. Low energy, fatigue, weight loss or gain. Some people are stress overeaters, some people are stress undereaters, and then difficulty concentrating, remembering details, or difficulty making decisions.
Yeah, that's one thing I've really noticed working with the patients is that most of them don't recognize that low energy, fatigue, difficult concentrating, disturbed sleep, these are all signs of depression. And you know, these are a lot of the symptoms that our patients present with, and most of the time we see on their intake form that, you know, there's a whole list of drugs that they're suppressing these symptoms with prescription drugs. Did you want to comment on that?
Yeah, you know, that's something that we get concerned about. I mean, you want to be careful that you're just not putting a Band-Aid on the symptoms and just suppressing them without really digging down underneath and see, you know, why is this happening and what else can we do? In fact, recently a study looked at the effectiveness of antidepressants, and it found that really the drugs produced benefits that were only slightly greater than a placebo in patients with mild to moderate depression. So that's an important thing to remember. In other words, a great majority of these patients did not see significant benefit from the antidepressants compared to placebo. The mainstream view of the cause of depression is about monoamine hypothesis, and it's a theory proposing that deregulation in neurotransmitter signaling is the sole cause of depression. And this really has been the grounds for the primary utilization of antidepressants in the management of depression for the last, I would say, 20 years. Tiffany is going to briefly go over that serotonin pathway for us.
Okay, so as you had just mentioned, you know, people who suffer from depression are most often advised that they have some sort of chemical imbalance, and they're usually prescribed some sort of medication to normalize serotonin levels. So I just wanted to review this flow chart, because when you look at the chemical pathway to serotonin, you know, most people don't even know where it comes from. So we really start by digesting proteins that we eat with stomach acid. And you need to have zinc and B6 and some other building blocks to create the amino acid called L-tryptophan. And then L-tryptophan needs an enzyme called tryptophan hydroxylase, and that needs some other cofactors, which cofactors are vitamins and minerals. In this case, we need folate, iron, calcium, and B3 in order to convert to 5-HTP. So once we have 5-HTP, which on that chart is 5-hydroxytryptophan, then we need another enzyme called dopa-decarboxylate, and then that needs more cofactors, so more vitamins and minerals such as B6, magnesium, zinc, vitamin C, and then we get serotonin. So, you know, there we have it. We call it the happiness pathway, because serotonin is known as the happy neurotransmitter. But the big point that I wanted to make on this slide is all of these vitamin minerals, they need to be in abundant supply for everything in this pathway to go smoothly. So I just want to make a point and stress here how diet is so important. And one thing that we do go over with a lot of our patients, because you need to supplement with certain vitamins and minerals just to get these cofactors for this pathway to work. So many reasons that our patients improve is just the quality of the vitamins and minerals that we use in our pharmaceutical grade supplements. They could possibly be helping this pathway along. So along with, diet benefits and getting vitamins and minerals, there also are a couple other thoughts we want to consider when battling with anxiety and depression. So Dr. Barber, why don't you go over the imbalances you commonly see with our patients here?
Okay. Hey, Tiffany, let me ask you, though. So I'm looking at this chart, and it looks like if I eat better and take my vitamins that I could have more of that happiness hormone. Is that what you're saying?
Well, it could be a piece of the puzzle. I mean, that's one thing that we do here. It's a very comprehensive approach. But diet, I think, underlying looking at the mineral imbalances and vitamin minerals, it's a huge part that can benefit patients when they get the right amount of vitamins and minerals in their system.
Mm-hmm. Well, let's look at this slide about the causes of depression, and certainly medical research has acknowledged the link between hormonal imbalances and depression. However, I find that most conventional doctors rarely evaluate and address the hormonal status when treating depression. Instead, a lot of times it's frequently dismissed, just being normal part of aging. And what we know is that restoring those youthful hormones may effectively combat multiple health deficits associated with aging, including mood imbalances and depression. So let's look over these several important biological factors that influence depression. That would be the impaired stress response, hormonal imbalances, chemical imbalance, nutritional deficiencies, and then chronic inflammation. And our goal here at Cenegenics is to help you correct the underlying imbalances and improve how the body works by really addressing the underlying problem.
Yeah, so let's go ahead and start with one of the first ones that you mentioned with, how chronic stress can affect depression.
Yeah, I'm happy to talk about this. I'm actually giving a lecture at a medical meeting that's about stress and how it speeds up the aging process. So I've learned a lot about it recently. We do know that the adrenal gland, which are tiny little glands that sit on top of the kidneys, increase the secretion of a hormone called cortisol when our body is under stress. And that can be any kind of stress. Emotional stress, physical stress, temperature can cause stress. So short term, this hormone is very, very important to aid in survival. It helps to mobilize energy reserves, for example. But long-term elevation of cortisol can really have detrimental effects. It's known that in typical normal patients not undergoing a lot of stress, the level of cortisol in the bloodstream peaks in the morning, and then it decreases as the day progresses. In depressed people, however, the cortisol peaks early in the morning and does not level off or decrease in the afternoon or evening. And the interesting thing here, too, I wanted to add is, in my research, what I'm finding is that when you add that on top of aging, which has the same effect on cortisol, peaks earlier and stays high longer, then that really exacerbates that effect of cortisol. So although the exact mechanism that causes depression is really uncertain, clinical studies suggest that chronically elevated cortisol may induce clinical depression by affecting serotonin production. And here's the other thing that's really, really interesting is that the chronic elevation of glucocorticoids, and that's primarily cortisol, caused by chronic stress, actually causes changes in the physical structure and size of the brain. So if you're under stress for long periods of time, and sort of the typical example of this in the literature are caregivers to a demented or ill spouse or taking care of an ill child. It can actually cause shrinkage of the brain, so important to be thinking about. So glucocorticoids also blunt the brain's sensitivity to serotonin, so that happy hormone, now the brain is not responding as appropriately to. We also know that stress can decrease immune function, so you're less able to fight off infection, and it also causes shrinking of the telomeres. And telomeres are those very important parts of our DNA that allow for replication of our DNA, and once they become short and fragile, then we have death of cells, early cellular aging, and increased risk of diseases. So stress, depression, all really important for your overall cellular health.
Absolutely. All right, well, next, why don't you go ahead and explain how hormone balance can help with depression?
Sure. You know, at Cenegenics, we often find hormonal imbalances in patients with depression. It's not uncommon for a patient to come in with some complaints of lack of motivation, sadness, poor sleep, etc., all things that are on that list for depression. It's important to discern which hormone is the underlying factor, and that's why we do a full blood panel looking at all of the 3 hormone levels to see, you know, which ones are in the right range. The first one I want to talk about is the thyroid. We know that the thyroid directly affects metabolism and brain function, and that low thyroid activity can definitely contribute to depression. Conventional medicine really relies on an overly broad thyroid lab panel and lab ranges, really failing to recognize many causes of suboptimal or subclinical thyroid function. And because the brain requires sufficient thyroid hormones to function optimally, a low thyroid hormone status can contribute to depression. We do a full panel looking at TSH, T3, T4, and thyroid antibodies compared to a typical lab or physician's office, which really looks at only 2 of that list of 4. I want to mention briefly a story about a gentleman that I met a few years ago, a Philadelphia police officer, a big burly Philly cop who had been doing great and in his 50s developed really severe depression. And he went through a big medical workup, couldn't find any reason for it at that time, and he was being admitted to a psychiatric hospital. Fortunately, the psychiatrist who was doing the intake evaluation put his hands on his thyroid and felt that his thyroid was enlarged and said, oh my gosh, this is your problem. Well, it turned out he did have a suboptimal thyroid function, and indeed he was treated with thyroid medication and did not have to be admitted, and the story has a happy ending. It certainly could have had a much, much, much darker ending. Sex hormones also. Sex hormones influence mood and depression. We now know that most steroid hormones, and that's pregnenolone, estrogen, progesterone, testosterone, DHEA, those are all neurologically active hormones. And in fact, the brain contains a great number of receptors for DHEA, estrogen, and progesterone. And these hormones affect many functions of the brain, including the regulation of mood, which is why we want to make sure that you're in the optimal range when we do our testing. There's a lot of research out there also showing that DHEA, which is also made by those tiny little adrenal glands, could help to relieve mild to moderate depression that starts in middle age. So extremely important to have that number checked, and it's a very simple hormone to supplement. And women tend to be more susceptible to anxiety and depression when they are pregnant or postpartum, premenstrual, and then again menopausal than any other times in their life. So we know that that hormonal swing can affect mood. Estrogen hormones have a significant effect on the brain chemical known as serotonin, which we talked about earlier, which causes feelings of happiness and helps to maintain a stable mood. Estrogen helps to stimulate the production and transmission of serotonin and prevents it from being broken down. So as you can see from this picture in the slide, when not enough estrogen is present during menopause, serotonin levels will drop, and this can lead to mood disorders and in some cases depression. Low levels of estrogen are also thought to cause depression during menopause because of its effect on cortisol, the stress hormone. Normally estrogen helps to keep the cortisol low, but when estrogen levels drop during menopause, women will have relatively higher levels of cortisol than before. So studies have found that high levels of cortisol can also lead to depression. A drop in estrogen during menopause causes many other symptoms besides hot flashes, anxiety, and insomnia. And these symptoms can lead to depression because of the physical and emotional stress they inflict on a woman going through menopause. We also know that testosterone deficiency has been linked to depression in men, which is not surprising since testosterone plays such an important role in brain function, including mood regulation. And in some studies, select populations of men were more likely to be depressed if their total and or free testosterone are low, and those included those with heart disease and in the elderly. Something else to note here is that if men have been on long-term treatment with SSRIs, which are those antidepressants, that they can lead to a decrease in free and total testosterone levels. So sometimes the treatment actually exacerbates the problem. Melatonin is a hormone involved in the sleep-wake function, and melatonin levels decrease with age. I'm not really familiar with any research studies on melatonin and depression, but I know that patients who are deprived of sleep, it starts a whole cascade of events beginning with overeating and anxiety, etc. So I know that balancing hormones is one of the key reasons our patients report improvements in their mood and physical symptoms once they start in our program. Now, nutrition is another very important factor. Tiffany, are there certain foods that can cause anxiety and depression?
Well, there aren't any specific foods that are known to cause depression, but certainly there are some foods that can contribute to the symptoms. Alcohol is a big one. Nearly 1/3 of people with major depression also have an alcohol problem, and studies are finding a strong link between, serious alcohol use and depression. But the big question is does regular alcohol consumption lead to depression, or are depressed people more likely to drink excessively? So research really is split on the issue. But it is possible that depression and alcohol abuse share a common genetic and environmental risk factor that can, trigger depression, anxiety, and some mood disorders. And then the other big ones that I want to mention is your, enriched flours and added white sugars. Basically, what happens when you have an enriched food like flour, what they're doing is they're stripping the whole grain of all of the valuable nutrients and also the fiber, and they just, grind it up into a fine powder. And there's actually a study published in the American Journal of Psychiatry in January 2010 that showed a positive correlation between processed foods, including enriched flour products, with depression and anxiety. And researchers had analyzed that the diets and psychological symptoms of over, I think it was 1,046 women. They looked at the enriched flour products digesting faster than the whole grain, and what it does is it disrupts the blood sugar levels and energy and moods of the patient. So for improved wellness, and one thing that we really promote here at Cenegenics is getting people to eat more of a whole grain diet, replacing the white breads, the white pastas, the refined cereals, and all the snack foods that are over-processed and in box with 100% whole grain equivalent. So also looking at fried foods, it contains a lot of saturated fat, and that's, the saturated fat is an unhealthy fat linked to obesity and heart disease. And the Mediterranean lifestyle diet, that has a link that is connected with a lower risk of depression. So another goal is getting people on healthy fats such as omega-3 fatty acids, some flax seeds, walnuts, salmon. Those can help improve mood symptoms, especially with depression. So you want to talk about some specific nutrients and vitamins. If we go to the next slide, diet and depression, I had mentioned before with the serotonin pathway. If we look at some food sources that help with serotonin production, we can go back to the B vitamins. If you're looking at food sources for that, brown rice, chicken, corn, eggs, your leafy greens, legumes, meats, nuts, peas, sunflower seeds. Also nutritional yeast is a big one. Looking at calcium and magnesium, because remember those were the cofactors in that serotonin pathway. So almonds is a big one that we like our patients to snack on. Also the cruciferous vegetables, sesame seeds, and then for magnesium, shrimp and salmon, and then of course tryptophan. A lot of people are familiar with tryptophan, you know, around Thanksgiving because it can cause you to have that feel-good, happy feeling after you eat it. So also looking, like I just mentioned, at the omega-3s, which are listed here, found in mackerel, salmon, sardines, tuna. A lot of people supplement with an omega-3 fish oil, which would include some of those. And then omega-6 with your eggs being a big one. I really like to talk about eggs because it's a high food that, or at least on my list, for increasing serotonin because it's a huge source of omega-3 fatty acid. And we just know that these fats can help improve mood with a lot of research studies, especially increasing serotonin in the brain. So, Dr. Barber, I know here we do a lot of evaluating inflammation in the body and teaching people how to decrease inflammation. So what would you like to say just about the link between depression and inflammation?
Yeah, I'm happy to talk about that. I mean, sometimes I think that's all we should talk about is inflammation because it's kind of at the root of all evil. We are learning more about it every year and its association with a whole host of diseases. And inflammation is caused by the release of internal chemicals, which are called inflammatory cytokines, and they are released as part of our immune system response. These chemicals, which also include tumor necrosis factor alpha, or TNF-alpha, interleukin-6, or IL-6, interleukin-1, or leukotriene, are all present in greater concentrations as we age. So that is a given as we move through the aging process. And reducing the concentration of inflammatory cytokines can reduce the risk of serious diseases, and that is one goal that helps to treat depression. And depression has long been linked to the risk, a higher risk of cardiovascular disease and heart attack, and we are just now beginning to understand why that is. Researchers are finding that depressed patients have higher levels of inflammatory markers in their blood. The increased inflammation that's brought on by daily stresses of life and depression can lead to psychological, physiological, and biochemical reactions in the body that damage the heart over time. Know that the body and the mind are really closely connected and they affect each other. We found that even though patients' depression gets better within the first 6 to 8 weeks of our program, it may take as long as 6 months for the inflammatory markers to return to normal. We also suggest that our patients that are here with a history of depression be routinely screened and monitored for inflammation and heart disease. And in fact, our heart disease and stroke prevention program does exactly that by looking physically at the carotid artery and looking in the urine at some markers for inflammation. Tiffany, I know you mentioned some vitamins earlier. Are there any other nutrients that you want to talk about?
Well, we couldn't have a webinar here on depression without mentioning vitamin D. It is an essential nutrient, and we've heard a lot of it in the news lately. But what most people don't understand is vitamin D is actually a precursor hormone. We know for years it's been critical for the health of our teeth and bones, but you know there's a lot more research out there showing how vitamin D plays a bigger role in our health. So I wanted to mention here with the relationship of vitamin D to depression, and one big thing that comes up as a seasonal affective disorder, also known as SAD. It's a situational mood disorder brought on by decreasing daylight in the winter months. So this is something we commonly see around the holidays, going through the winter. That high doses of vitamin D during these months have been proven to be a very effective therapy for seasonal affective disorder, leading us to believe that, possibly neurotransmitter function depends on this vitamin D synthesis. So I know that's one thing we test here for at Cenegenics, and we commonly see low. I mean, even being here in South Carolina, you would think with as much sun that our patients are exposed to as with our local patients that their vitamin D levels would be normal, but they can be very low. So it's just one piece of the puzzle when it's looking at depression that we want to make sure that those levels are optimized.
Another therapy for SAD is light therapy, and that's really where you sit or work near a device called a light therapy box, and that box gives off a bright light that mimics the natural outdoor light, and it can help to affect brain chemicals linked to mood and ease those SAD symptoms. So it may be something you want to try if you've got some depression, sleep disorders, or other conditions, because it may be helpful for that, and it really has a few side effects. Also, it's a good time, Tiffany, to take a trip to the Caribbean and catch a little sun as well.
Oh, that sounds good to me. All right, well, I know, Dr. Barber, you are a huge advocate of exercise. So what can you tell us about exercise helping with stress and anxiety and depression?
Well, really, exercise is probably the single most effective mood elevator. It increases not only the brain's dopamine levels, but also endorphins. Those are the neurotransmitters that create a sense of well-being. And many researchers feel like the lack of physical exercise may be one of the major reasons for the increasing amount of depression in our society today. So exercising regularly, at least 4 times a week, for a half an hour each time is really essential. And if you can get outside and do that, then you're also getting the benefits of being outside at the same time. Numerous research studies have shown that exercise benefits both anxiety and depression. Not only does it provide a jolt of endorphins that can be enjoyed short term, but it provides a substantial boost in confidence. And that is required for long-term lifestyle changes. That increases blood flow to the brain, provides pulses of nutrients and oxygen to the brain that are really required for that ongoing healing. This increased circulation, too, also improves venous return. In other words, that old blood that carries away waste.
Well, that's great. Well, I wanted just to end here. It was funny, when I was doing a little bit of research for this webinar, I came across a study it was a research study done at the Mayo Clinic, just talking about stress, anxiety, and depression being able to be helped with laughter. So just reminding people, laughing pushes your body into that different physiologic state, much like, or not being in that fight and flight stressful state, it pushes you into the more relaxing parasympathetic state. So we just want to remind people to enjoy some laughter in their life and allow those hormones to promote relaxation and calmness and a sense of well-being. So I want to thank you, Dr. Barber, and thank you to our listeners who tuned in tonight. We hope that you got some positive insight as to how our program here at Cenegenics can help with depression and anxiety. And just another reminder, if you are on antidepressants, we are not recommending you stop your medication. Stay on your medication, and then just you can call us, and we will be happy to answer any questions you might have. So I know we do have a lot of people here on the webinar tonight, so I'm going to have Lindsay open it for questions. So thanks again.
Thank you, Dr. Barber and Tiffany. That was really great. That was a lot of really wonderful information. It looks like we actually had a couple questions from the audience during the presentation, so we'll have just enough time to answer those questions. The first question that we have is someone asked 2 weeks ago, 60 Minutes had 2 experts who said that antidepressants do not work any better than placebos. Do you care to comment on that?
Sure, I'd be happy to comment on that. I actually saw that program, and I'm familiar with those 2 individuals, and do know that that is really their bandwagon that they're on, is that antidepressants are being over-ordered. So that being said, what we know about the placebo effect is if you took 10 people and lined them up and gave 10 of them a sugar pill, 3 to 4 of those 10 people would have a benefit from that sugar pill. So that is a given no matter what medication, no matter what therapy, that there is about a third of individuals will respond to even no therapy. So I'm not surprised by that. You know, that doesn't mean that antidepressants aren't right for some people, but certainly people with severe depression, that may be the only option that is going to get them through that period.
Great. Okay. The next question that we have here is, what are the dosages for vitamin D?
Do you want to speak to that, Tiffany?
Yes, I mean, we really recommend that you have your levels tested, but, you know, depending on your levels and also the time of year, considering that our levels do drop during the winter time, you know, a standard dose could be 2,000 IUs up to 5,000 IU, but that's just kind of a maintenance dose. We, of course, like to individualize it for each patient based on what we find when we get their blood work back.
Sure.
Okay. Great, and I guess we have time for one more question. The last question is, can I buy DHEA at my local drugstore?
You can, but I wouldn't recommend that. DHEA is a hormone, and up until probably 10 years ago, it did require prescription. And for some reason, the FDA changed that regulation, and now it can be purchased over the counter. But just to point out that there's a big difference between what's over the counter, which is not manufactured at pharmaceutical grade level, which means that pharmaceutical grade, besides the purity of the product, also is looking at the content of the product. And that content, in other words, milligrams, are checked 3 or 4 times during the manufacturing and packaging of the product. So we've had patients come in who were taking over-the-counter low-dose DHEA who had incredibly high doses or high levels of DHEA when their lab work was drawn, and in fact they had symptoms of DHEA toxicity. So it is actually the one hormone that I absolutely won't budge on, that I require the patients get from us.
Okay, great. Thank you so much. That's all we have time for tonight. If anyone else in the audience has questions, we encourage you to give us a call tomorrow. We'd be more than happy to connect you directly with Dr. Barber or Tiffany to discuss any additional questions that you may have. Please feel free to contact Dr. Mickey Barber directly at 843-577-8484 or email her at mbarber@cenegenics-carolinas.com. You can also register online for more information at www.cenegenics-carolinas.com. Cenegenics Carolinas is open Monday through Friday, 9 a.m. to 5 p.m. Eastern Time. Again, you can reach Dr. Mickey Barber directly at 843-577-8484. Email her at mbarber@cenegenics-carolinas.com or register online at www.cenegenics-carolinas.com. Thank you so much and have a great evening.